Hi everyone, this is Elaine R. Davis, Realtor with Realty One Group, and this is Real Life Treasure Coast. Today we are at Nova Intensive Care, which specializes in all types of mental health, outpatient therapy, counseling, group support. We are going to be talking to the founders today, Rebecca Booth and Pilar Gutierrez. I'm so excited. This office is beautiful, calming, and I've known Rebecca for almost 10 years now, and she is amazing. This is going to be such a great interview, so you can find out what you need to do to be healthy and on your way to your best self. Hi everyone, here we are with Rebecca Booth and Pilar Gutierrez, founders of Nova Intensive Care. Rebecca, can you tell us how this whole business was thought of, founded, came up with?
So Nova Intensive Care kind of came into being when I needed a therapist. And I reached out to Pilar and I said, hey, this is what I'm going through. Can you make any referrals? And we kind of rekindled an old relationship. And as I reached out to the referrals that she was giving me, because we're friends, so she can't be my therapist, we realized that people were booked round the clock. She was booked round the clock. So we kind of both sat on that information for a little bit, and she called me up one day and she said, you know what, I think that the city, the people, they need more. And I think that we are in a position to be able to offer more. So we kind of came up with the idea of opening an intensive outpatient program. But because outpatient itself was already running so tight, we realized we needed more help. And that's when Pilar was able to bring on Noelle and Brittany to assist in the outpatient so we could really bring the IOP into being.
Awesome. So Pilar, what is your vision for Nova?
So I have been working in the city of Stuart since 2017. Started part-time while I was holding a full-time job, and I saw the increase in need of mental health and outpatient therapy. So outpatient therapies, usually you come to the office once a week for an hour, weekly or bi-weekly or monthly. And I thought the transition from having a full-time job to part-time was going to be really slow, and it was immediately full. So there was a high demand, and we do work with insurance, so we are in network. So people are able to use their medical insurance, pay an affordable copay, and receive the quality services that they need. I have background in substance abuse, I have background in acute mental health, and background in dual diagnosis. So we provide assistance and help and therapy, whether it's through coaching, whether it's through some case management, therapy, to individuals from sober living, halfway houses, hospitals. We want to help the community by providing really quality with experienced providers. So we are growing and expanding, and want to put ourselves out there so people can see what we can offer. Mm-hmm. And see that we want to make them feel comfortable when they come. Mm-hmm. We want to meet them where they're at, and also provide a safe space here in person.
A beautiful safe space.
Thank you. Yes.
So you talked about a couple things, lady, that I want to touch on a little bit further. Becky had said IOP, outpatient. You had said substance abuse, meeting people where they're at, and one of you can touch on that a little bit further, because I think it's really important to understand specifically what type of care you can provide. Can I come here just to talk to you? Can I participate in a group? Let's talk about exactly what care you provide.
So I can start with the outpatient therapy.
Sure.
Outpatient therapy is most likely usually once a week for an hour a day, could be 45 minutes. And the stigma is that you have to have like severe mental health, and you don't. You don't have to have a mental health diagnosis. You don't have to have a history of mental health or psychiatric care. If you are struggling with life, if your job is stressful, if you have a lot of life losses, if you went through a breakup, if life is just difficult right now for you.
Real life, you can come here.
Right, and you feel overwhelmed, and sometimes it can be a bit much for the family or for the loved ones around you. So a person from the outside can really help because they see another perception, another, and can give you feedback. So if you are struggling with life issues, period, this is a good safe space and opportunity to help you figure things out. Therapy, outpatient therapy can go from a couple of sessions to long term. It can go from once a month, twice a month, every week, twice a week, as much as the person needs. The other aspect is when we work with mental health, when you have history of mental health diagnosis and you have disorders and just because you need to maintain stability and work and just make sure you're growing. Growth is a big aspect that we address. A lot of people, they just want to grow.
Yeah.
Like I'm stagnant, like there's something going on with me. Like I'm functioning, but you know what? I'm not really growing.
What can I do to get to the next level?
What can I do, and what can you help me discover?
Awesome.
Because we really don't tell people what to do. We help them find a way because it's not about us. We are here to facilitate your journey.
Awesome.
And hopefully to find peace, joy, and happiness.
I love peace, joy, and happiness, and this is such a calming environment, and I feel so comfortable sitting here talking to you ladies, so I want to come for some therapy so I can take it to the next level.
So that will be the outpatient, and Rebecca can explain the intensive outpatient.
So my specialty is actually in substance abuse. I have addiction counseling behind me, and I am actually a recovery coach, as well as in the process of getting the peer recovery support specialist certifications.
Awesome.
So with that being said, our intensive outpatient program will be strictly focused on substance abuse. So individuals who have already completed a detox or are coming out of residential or even a PHP level, but they aren't ready to face the full brunt of life on their own, they would be the individuals that we would be assisting in their continued growth. So what happens is a lot of people go into treatment and they thrive while they're there because there's so much structure. You're in group, they tell you when to wake up, they tell you when to go to sleep, they tell you when to eat, they tell you when to think, ultimately. And the problem with that is you step back out and life comes back at full force. You've got jobs, you've got families, you've got normal everyday demands. So intensive outpatient helps you tackle those everyday demands with support and encouragement. Intensive outpatient runs 3 days a week usually. We will be offering morning and evening to really fit inside everybody's working schedules. So IOP doesn't disrupt your life, but it enhances your life.
Yeah.
So we will work around people's work schedules, and then we will offer a group setting where they can connect with other individuals who are also trying to grow and reach the next level in their recovery. And inside that environment, there's automatic fellowship, there's automatic support, there's automatic encouragement that comes along with that group setting. So IOP is something that I'm very passionate about. I think that it offers the true next step when you're really ready to commit to being clean and sober for the rest of your life. The intensive outpatient also offers private therapy, one-on-one outpatient with your therapist. So you will also be able to receive that one-on-one time with someone to continue your personal growth outside of the group setting.
Beautiful. I love what I'm hearing from both of you because there is the stigma that Pilar had talked about a few moments ago, that you have to have severe mental health issues, or that mental health can't be addressed for small hurdles you need to get over in life, or once you go to treatment's over and then you move on. And it sounds to me like you ladies really just want to help people be the best that they can possibly be.
Absolutely.
And I think that's perfect for anyone. So this is a beautiful practice. I know that you're doing a great job here, but I also know that you're very active and involved in supporting the community. Can you tell us a couple things about what you're doing to give back?
Absolutely. So Nova Intensive Care has an Adopt a Street out in Port St. Lucie, because that's where I live, so that's where she lives. It just makes it easier.
Treasure Coast, all about the Treasure Coast, Martin and St. Lucie County together.
So we actually were present at the Caring Community Cleanup Day that happened just last weekend. And that was where every single Adopt a Street came together and collected garbage that was reported back to keep America beautiful. So I can't wait to hear those numbers, because I think a lot of garbage was collected. But we were able to be there as a company. We had a booth out, and we were able to interact with a lot of the individuals who are also looking for ways to give back to their community. This coming Saturday, we will be present at the Pride Alliance. So we're excited to also be able to be a part of that and support people as they realize who they are and what they want in their lives, and they grow towards that.
Awesome. Super amazing.
And additionally, being able to provide to the community resources at a faster pace. For example, when we get a referral, hopefully with our resources and therapists, we can get you in without having to lapse too long. So working with doctors and hospitals and other programs to get you the help that you need soon. The sooner the better. Being there, like, we will look into that referral. It's not going to pile up. So providing that support and networking, that, you know what, we know this program, and you can call them and they're going to answer the phone. They're going to call you back. They're going to follow up. I think that's really important for providers.
Absolutely, because especially right now, it's one of those things, sometimes you call a doctor or a provider and it's a month, 2 months, 3 months before you can even get an appointment. And if something's going on in your life, it could be totally different in 3 months from now.
Right. And also, if we are not able to provide the resources or the needs that, at the moment, help you figure it out, we do take the time to talk to people on the phone and to guide you. Absolutely. I know other providers in the area might be a better fit for you, might have your insurance, whatever the reason is. So also to help them figure it out. It's not going to be like, I'm sorry, I don't take your insurance, good luck. It's like, well, I know this person, that person, or this is where you can go to have more resources.
So not just being a community provider, being a community resource to guide people.
We will do our best to do that, absolutely, yes.
Awesome. Ladies, what else would you like to share with our viewers today?
I would like to say that it is okay to ask for help. Don't self-reject. Don't try to do everything on your own. You surely can, but it's easier when you have help. It's easier when you have networking with other people that maybe you can relate to. Like we said earlier, you don't have to have a mental health diagnosis. Being able to talk to someone, to be heard and validated is really important. That itself can help you feel better. We all have problems. We all have life stressors, especially during this difficult pandemic. Life has gotten really hard, and we're fragile. Allow yourself to get help. You're gonna feel the difference. And if you want to do self-growth, you also deserve that opportunity to expand and to see what the options out there. If you need to change careers, if you need to, whatever is it that you're looking for, we would love to help you guys figure it out with whoever therapist you want to work with, whether it's life recovery coaching with Rebecca or myself as a clinician, or Noelle or Brittany, our other therapist. We want to welcome you to our practice. We're located in Stuart. We do in-person and also telehealth to try to best fit your needs and your schedules.
Thank you so much.
You're welcome.
Becky, would you like to add anything?
So Nova Intensive Care, quality mental health services so you can live your quality life.